Have you ever felt like your days just don't have the same bounce they used to? Maybe climbing the stairs feels like a bigger challenge, or enjoying a simple walk leaves you feeling unexpectedly drained? You might just think, well, that's just part of getting older, isn't it? And while some changes are natural, what if those feelings are a sign of something important that you can do something about? Today, we're talking about managing diabetes, specifically looking at medications. Now, medication might sound complicated, but for many seniors, the right approach to diabetes medication isn't about adding burdens. It's about regaining that energy and vitality you thought might be gone. It's a simple tool, when used correctly, that can make a world of difference. Living with diabetes, especially as we age, can feel like navigating a maze. Uncontrolled blood sugar isn't just about a number on a test strip. It can slowly chip away at your independence. It can make you feel tired, fuzzy-headed, increase your risk of dangerous falls, and over time, impact your vision, your feet, and even your heart. You might accept these changes, thinking it's inevitable, but the truth is, managing your diabetes effectively is key to holding on to the life you love. The good news? You have more control than you might think. In this video, I'm going to share several crucial things you need to know about diabetes medication specifically for seniors. We'll cover what to consider, what to watch out for, and how to work with your doctor to find the best approach for you. These aren't complicated medical lectures. They are simple, practical insights that can help you feel better and live more fully. Before we dive in, if managing your health and maintaining your independence is important to you, please go ahead and give this video a thumbs up right now. And don't forget to subscribe to the channel and hit the notification bell so you don't miss our future health tips. Let me know in the comments below if you're ready to learn about diabetes medication by typing ready. All right, let's start with the very first thing you need to consider. Point 1. Understanding why medication might be needed. First off, let's address why medication might be necessary, even if you're eating well and staying active. As we age, our bodies change. Sometimes, even the best diet and exercise aren't enough to keep blood sugar levels in a healthy range because the pancreas might not produce enough insulin, or the body doesn't use insulin effectively. Medications step in to help bridge this gap. They can help your body make more insulin, help the insulin you do make work better, or help remove excess sugar from your bloodstream. Think of them as supporting players on your health team. I remember my neighbor, Robert. Robert was so diligent with his diet and walking every day after dinner. But despite his best efforts, his blood sugar numbers just wouldn't consistently come down. He felt so defeated and, frankly, pretty tired most of the time. He thought maybe he just wasn't trying hard enough. His doctor suggested adding a simple oral medication. Robert was hesitant at first, feeling like he'd failed somehow. But within a few weeks of starting the medication, carefully monitoring his blood sugar, and continuing his healthy habits, his numbers stabilized. More importantly, his energy levels soared. He told me he felt like he got a part of himself back, able to keep up with his grandkids on walks again. It wasn't about failing at diet. It was about giving his body the specific support it needed at this stage in his life. Robert's story shows that medication isn't a sign of defeat. It can be the key to unlocking better energy, reducing fatigue, and preventing those frustrating symptoms that hold you back. The advice here is simple. Don't view medication as a last resort or a sign you failed. Discuss with your doctor if medication could help you achieve better blood sugar control, even if you're already making healthy lifestyle choices. Okay, that brings us to our second important point. Point 2. Different medications, different needs. It's important to know that there isn't just one diabetes pill. There are several different types of medications, and what works best depends on you. Diabetes medications work in different ways. Some help your pancreas release more insulin. Some help your body become more sensitive to the insulin it makes. Others might help your kidneys remove sugar or slow down sugar absorption from your food. Because everyone's diabetes is slightly different, and because we have different bodies and different needs as we get older, your doctor will choose a medication that targets the specific issues your body is having with blood sugar control. Think about Mary. Mary had been on one type of diabetes pill for years, and it worked reasonably well. But over time, her blood sugar started creeping up again, and she was experiencing unpleasant side effects like stomach upset. Her doctor evaluated her and suggested trying a different class of medication, one that worked on the kidneys. Mary was nervous about switching after so long, but the new medication not only brought her blood sugar back into a good range, but it also didn't cause the stomach issues she'd been dealing with. She felt so much better physically, and her doctor explained that this new medication was also a good choice considering her kidney health, which is a common concern as we age. Mary learned that sometimes switching medications is necessary as your body and your diabetes change. Mary's experience highlights that the right medication isn't just about numbers. It's also about feeling good day to day and choosing a medication that works with your body's unique situation. Don't hesitate to talk to your doctor if your current medication isn't working as well or if you're experiencing side effects. There might be other options that are a better fit for you now. Now, this next point is absolutely vital for your safety. Point 3. The crucial balance. Avoiding low blood sugar. While keeping blood sugar from going too high is key, for seniors taking medication, preventing blood sugar from dropping too low is just as, if not more, important. Certain diabetes medications, particularly insulin and some types of pills, can sometimes lower blood sugar more than intended, especially if meals are skipped, delayed, or smaller than usual, or after unexpected physical activity. For seniors, low blood sugar, called hypoglycemia, can be very dangerous. Symptoms like confusion, dizziness, weakness, or shakiness can increase the risk of falls, which can have serious consequences. Your body's warning signs for low blood sugar might also be less obvious as you age. I heard a concerning story about David. David lived alone and was very independent. He was on a medication that could cause low blood sugar. One afternoon, he felt a bit off, but just sat down to rest, thinking he was just tired. He didn't recognize it as a low blood sugar episode. He became disoriented, stumbled, and had a bad fall, breaking his wrist. When the paramedics arrived, they checked his blood sugar, and it was dangerously low. His doctor later explained that they needed to adjust his medication dose and timing and make sure David knew the signs of low blood sugar and always had a quick source of sugar nearby, like glucose tablets or juice. It was a scary reminder that while managing high blood sugar is important, preventing lows is critical for senior safety and independence. David's story shows how easily low blood sugar can lead to a loss of independence through falls and injuries. Learning about and preventing lows is a direct way to protect your safety. Talk to your doctor about your specific medication and the risk of hypoglycemia. Learn the signs of low blood sugar for you. Test your blood sugar regularly as advised, especially if you feel unwell or your routine changes. Always carry a source of fast-acting sugar. Are you learning something new about your medication? Let me know in the comments. Beyond blood sugar itself, we need to think about your overall health picture. Point 4. Your other health conditions matter. Most seniors have more than just diabetes. You might also have high blood pressure, heart issues, or kidney problems. Your diabetes medication choices need to fit with all of your health needs. Many diabetes medications can affect or be affected by other health conditions. For instance, some can impact your heart, some are processed by the kidneys or liver, and they can all potentially interact with other medications you're taking. Your doctor needs to consider your complete health profile to choose a diabetes medication that won't worsen other conditions or cause dangerous drug interactions. Let me tell you about Susan. Susan had diabetes and also managed high blood pressure and heart palpitations. She was taking several pills each day for her different conditions. When her doctor was reviewing her medications, they noticed that her current diabetes medication wasn't the ideal choice given her specific heart issues. They switched her to a newer type of diabetes drug that not only helped her blood sugar, but also offered some protective benefits for her heart, without causing side effects that worsened her palpitations. Susan said it was a relief to know that her doctor was looking at her whole health, not just her diabetes numbers in isolation. It made her feel much more confident and secure about her treatment plan. Susan's story shows that your diabetes care should be integrated with your care for all other health conditions. This holistic approach leads to better overall health and fewer complications. Always keep an updated list of all medications, supplements, and vitamins you take. Share this list with every doctor you see. Don't be afraid to ask your doctor how a new diabetes medication might affect your other health conditions or interact with your other pills. Speaking of other conditions, kidney health deserves a specific mention. Point 5. Kidney function and medication choice. Our kidneys play a big role in filtering our blood and processing medications. As we age, kidney function naturally changes, and this significantly impacts which diabetes medications are safest and most effective. Many diabetes medications are cleared out of the body by the kidneys. If kidney function isn't optimal, the medication can build up in your system, increasing the risk of side effects or complications. Some diabetes medications are better choices for people with reduced kidney function than others. Your doctor will check your kidney function regularly, usually with a simple blood test to make sure your diabetes medication dose and type are still appropriate for your kidneys. I have a friend, James. James had diabetes for many years. During a routine checkup, his doctor noticed a slight change in his kidney function test results. It wasn't severe, but the doctor explained that the diabetes medication James was currently taking wasn't the best long-term choice given this change. They switched him to a different medication that was known to be safer for the kidneys and even had some benefits for kidney health in people with diabetes. James didn't feel any immediate difference, but he was grateful that his doctor was proactive. He felt reassured knowing that his medication plan was looking out for his kidney health down the road, preventing potential future problems. James' story shows that considering kidney function is essential for long-term safety and effectiveness of your diabetes medication, helping you avoid potential complications later on. Make sure your doctor tests your kidney function regularly. Ask them how your diabetes medication choice is affected by your kidney health and if the dosage is appropriate. This is a key conversation to have. Found these points helpful so far? Share this video with a friend. So, how do you put this knowledge into action? The most important step is open communication with your healthcare team. When you see your doctor, come prepared. Write down any questions you have about your current medication or potential options. Mention any side effects you're experiencing, no matter how small. Discuss your lifestyle, your diet, your activity levels, and any other health concerns. It's a partnership, and your input is valuable. A big mistake to avoid is changing or stopping your medication without talking to your doctor first. Even if you feel better or worse, sudden changes can be dangerous. Also, don't think medication is a substitute for healthy habits. Diet and exercise remain the foundation of diabetes management. Another error is relying solely on information from friends or the internet. While helpful, it's not tailored to your unique health situation. Remember, medication is often part of the plan, not the whole plan. Lifestyle adjustments, choosing healthier foods, moving more are still incredibly powerful tools. For some, newer technologies like continuous glucose monitors (CGMs) can also be helpful alongside medication, giving you more insight into how your body responds. Discuss all options with your doctor. And let me be very clear, I'm sharing general information here, but I am not your doctor. Diabetes management is complex and highly individualized. Always consult with your physician or healthcare provider for personalized advice regarding your specific condition, medications, and treatment plan. They are the best resource to guide you. We've talked about why medication might be needed, the different types available, the importance of avoiding lows, considering your other health conditions, and kidney function. All of this knowledge boils down to one thing. Taking control of your diabetes is about more than just numbers. It's about having the energy to enjoy your hobbies, the stability to feel confident on your feet, and the health to spend quality time with the people you love. These considerations might seem like a lot at first glance, but they are manageable steps. It's about having informed conversations with your doctor and making small, consistent efforts day by day. It's simpler than you might think once you have the right information and support. I know sometimes it's easier to put off thinking about health challenges, especially as we get older. We might hope things will just get better, or we accept feeling under the weather as normal aging. But ignoring the signs or not addressing your diabetes effectively can unfortunately lead to bigger problems down the road. Those falls, nerve damage, or heart issues we mentioned. These can truly limit your freedom and create unnecessary hardship. I've seen it happen, and it's tough to watch. But you have the power to choose a different path. You have the right to pursue feeling your best, regardless of your age. Taking an active role in managing your diabetes, including understanding your medication options, is an incredibly empowering step. It's about choosing independence, choosing vitality, and choosing quality of life for yourself. It is absolutely never too late to start making choices that honor your health and well-being. So, as you can see, navigating diabetes medication for seniors isn't just about filling a prescription. It's about making informed choices, working closely with your doctor, and understanding how your medication fits into your unique health picture. It's about preserving your independence, your energy, and your ability to fully participate in life. What was the most surprising or helpful piece of information you learned in this video? Please share your thoughts and questions in the comments section below. I love hearing from you and building this community. If you found this video helpful, please show your support by hitting the like button. If you haven't already, subscribe to the channel for more practical health advice tailored for seniors. And this is a really important one. If you know anyone, a friend, a family member, a neighbor who is managing diabetes as a senior or who might benefit from this information, please share this video with them. This knowledge could truly make a difference in their life. Thank you so much for watching today. I truly hope this information empowers you to have better conversations with your doctor and feel more confident in managing your diabetes. Wishing you health, happiness, and many vibrant years ahead. Take care, and I'll see you in the next video.